Welcome, everyone. Oh my gosh, I'm so excited to be here today with a very special guest. The Rejuvenating Healers Show is an educational platform and space that's focused on self care for our caregivers. And so, as we explore bridging ancient and modern wisdom, we're going to also be reevaluating our current healthcare paradigm and explore how it can evolve to embody cultural awareness that supports individuals and communities as whole beings. And without further ado, I am so excited to introduce Manmeet, Dr. Manmeet Rattu, and a dear sister of mine, friend, colleague, who is joining us today to share her wisdom with us and experience as a mental health professional. And Charlie, I will turn it over to you to go ahead and
Yes,
introduce.
thank you. Yeah. So here's her bio. She has worked with patients ranging from geriatric to pediatric and applied interventions in various modalities, such as cognitive behavior therapy, acceptance and commitment therapy, mindfulness based stress reduction, and compassion focused treatment. Her interest in physical well being and emotional fitness, and she has over 15 years of research, clinical counseling, mental health, patient advocacy, hospital administration, and patient services. So she's really well prepared in any environment you can throw at her. And she's a trained professional yoga psychologist instructor, where she integrates her research in modern neuroscience with ancient teaching in Yoga and Ayurveda, which is just like what we said about what we're trying to do. So very excited to have you on our show. And my cat really want to say hi.
Thank you both for having me. I'm really excited to be here and connect.
Yeah, Minnie, we're so and we're so Dr. Rattu also goes by Dr. Minnie, so you'll hear us referring to her as Dr. Minnie. And again, this is just such an honor to have you. Your experience, your background is, I mean, like Charlie was saying, I mean, and I know there's more too that that's not even stated there. So thank you for taking the time to share with us. And I'm really curious and kind of want to just jump in right now because we're facing so many challenges as healers and healthcare professionals. And I'm curious, like, what are some challenges that you have faced in your journey being a mental health professional and a doctor with your patients?
Yeah, well, thank you for again that lovely introduction. And I think being a clinician, it has been a journey in of itself. That there's been a lot of changes that I myself have experienced as a result of my work. And it's really what are the clients bringing to me? What's going on in the collective that I'm absorbing, and how I can better be of service to the people that are coming to me. And most of my patients do initially come in for anxiety or depression, sometimes relationship issues, something that they think or may feel that are challenging and getting in the way, interfering with their relationships or things at work or just their daily well-being. And a lot of times what they'll start discovering is that there are a lot of deep-seated traumas and things that they have not overcome from earlier in their life and in their experiences that I've also had to dive into with them. So I work mostly from a cognitive behavioral therapy perspective, CBT, as Charlie was saying. And that's been demonstrated to treat a wide range of issues like depression, anxiety, alcohol and drug problems, all kinds of things. But what I've also found is that there is a spiritual component that really needs to be addressed. And sometimes in Western medicine, or at least in the model that I was trained in, that's been something that we've kind of stayed away from. And so I really am learning that, what are some ways we can bring the spiritual healing back into the work that we're doing as clinicians, and even in Western medicine. Are there ways that we can start addressing some of that healing that needs to happen? And thanks to, a lot of research that is being done now on yoga and mindfulness and meditation, we have some science to show that what these behavioral interventions can do to the mind and body. And so that's making it more accessible for many people. But still, I feel like there's still a lot more that can be done. And I'm kind of finding my way in in that kind of like that transition myself, because I have this background in yoga and meditation, and then also in CBT and clinical work as a psychologist. And I'm really trying to bring those two together, those two worlds together. And that's why, being here with you guys, I just feel like it's such a great way to integrate all of those components that I've been learning, even in my own journey, in my own personal life.
Oh, yeah. I'd love to also ask how has things changed since post-COVID, right? Because a lot of lockdown, isolation, a lot of us kind of went through this PTSD of being isolated. So have you found things going up or worse after that time?
Yeah, I feel like initially people were very worried and very anxious and not knowing how to manage uncertainty. Because when it comes to anxiety, it's really about the brain likes to predict what's going to happen. It likes to know what's next, and we like predictability, we like routine. And that's why structure can be really important. But when that's taken away, like during the pandemic, there was a lot of uncertainty, not just from the individual who may have already been experiencing some anxiety, but as a collective, everybody was feeling uncertain about what's going to happen. And people were not prepared on how to manage uncertainty because they were so used to their daily routine or things that they were accustomed to that was taken away. So as far as it getting better or worse, I feel like it comes in waves. I don't know if it's gotten better, but at least the clients that I'm personally working with, my hope is to help them better manage anxiety and stress, and even their interpretation of their experiences like trauma. But it's not something that can ever really just go away. Even anxiety is not something that we can just get rid of. It's just learning the tools and the strategies to manage these things and manage uncertainty, and learning to ride the wave sort of, when these things happen. Can we become better accustomed to that? And and then it's really important to have support around that too. So, I feel like a lot of people did come forward after the pandemic to bring healing into the world, like the work that you all are doing, and, and community service and community work. Like that's been really important for a lot of people where initially in the pandemic, when that happened, that was hard to access because we literally couldn't see each other. We couldn't be together. But because of technology, online forums, that there are some things that are still accessible, and people are learning a lot more about how important social connection is, and why we need that. We can't be doing things on our own all the time.
Yeah, I'm curious too, how has your journey as an Indian woman, here in the States, really shaped your perspective and approach to the way you treat your clients, and like culturally, and yeah, I'm just curious like what that journey has looked like for you, and how it's beneficial potentially more to your clients, that because of this background that you have, because of this journey that you've had, and your perspective really bridging the spirit alongside with the behavioral components, right? Which, like you said before, kind of being trained in this modern medical system, we really only focus on behavior, right? And like leave out the spirit. So yeah, if you could share a little bit more about that journey for you, and how you got to where you are.
Yeah, so I was born and raised in Northern California, and I do come from Punjabi culture, which is a North Indian state, from the state of Punjab. That's where my family's from. And so we ourselves as a culture are very close knit and community oriented. So anytime there's distress or problems in the family or in the community, we do gather. That's the first thing we do. So anytime there's a death or couples are having problems, we were always having people over our house. I still remember my parents counseling couples, or If somebody needed a space to live or a space to stay, while they're getting their life together, we always had guests over a house. It was almost like my mom would joke, it's like a hotel. So we were always together, and that was how we would resolve issues and problems. And so we would talk about it and come together and literally sit in circles. And we still do that to this day. And also at our temple, at the Sikh temple, we do this too, where people gather and there's social connection, there's community, there's food, there's an ongoing service of a kitchen that's open. So, collectively healing is a part of the narrative, the way that I grew up. But as I got older and became a psychologist, I really learned quickly, like, this culture that we live in is individualistic, the American culture, the Western culture. So there's a lot of things that people, I guess I didn't know that people don't have their families to rely on all the time until I got older, because I was so used to just being around other Indian people. And then I realized that, like, a lot of people have nobody, or they have no one to talk to, and they're so used to being on their own and trying to figure things out on their own. And sometimes talking is difficult, and sharing things is takes a lot of vulnerability, and it's a big risk for many people. And so, what I've found now, at least in the work that I do, is that I feel like it's both are good. That we need time for individual solitude, and which is like, there's two sides of the same coin when it comes to being alone. There's loneliness and there's solitude. And so solitude is very healthy. We all need time to be alone with ourselves and with our thoughts, and to reflect on what it is that we need. What are the underlying needs that we have? What are the emotions that I'm experiencing? And only then can I articulate that to others so that I can get the support that I need. But then there's also, as a collective, sometimes, you not saying anything, but just being around people that love you and want to support you, and just, they're feeding you, just kind of having that community to go to remember that you have a tribe. Like, that's also very important and very necessary too. It's a primal need that we have to be in community and in connection with others. So today I share with others, I recommend both, to have time for solitary practices like journaling, exercise, meditation, spending time in nature. Those are great solitude practices, but also having communities to lean on, so getting that social support, and finding people that you can trust, and finding, that the support network is really important too.
Yeah, something you just said really resonated with me because, when you think about feeling depressed or feeling down, loneliness, all of these things, like, how many times do you just not even, you can't even like create a meal for yourself, right? So you can't even nourish yourself, and that's also coming back to this like rejuvenating the healers theme that we're in, where it is at that point, it's like when you do have the community to lean on, it really does rejuvenate you, and it really lifts you up when knowing that you can count on people to support you in that way. So I really appreciate you saying that and sharing what you have, what you embody, and what you bring to your clients with this perspective of community and the importance of that. And with that, I also think I would love to hear a little bit more too, just for our listeners, about how collective trauma, and you just spoke to your background as a Punjabi woman, Sikh faith, and the things that your culture, specifically the Sikhs, have gone through over the last few hundred years, right? Like, that when we talk about collective ancestral trauma that we're carrying, what can you share about that, and how that is affecting us as a collective?
Yeah, I appreciate that question, because it's so true, right? Intergenerational trauma is something that we all carry, because we carry not only the genes of our ancestors, but also the legacy and the narratives and what's been passed down to you generation from generation when it comes to safety and connection, and and ourself and others. how do we learn to trust ourselves? How do we learn to trust others? And I know growing up Sikh, we're only 1.8% of India's population, and most of us are diaspora because we've had to flee due to oppression from the larger collective, which is the Hindu government. So a lot of Punjabis and Sikhs, even though it's the fifth largest religion in the world, they're spread out. But even though they're spread out, they're in collective communities. So that's why where I grew up in Northern California, we knew so many Indian Punjabi families because everybody kind of does everything together. We trust each other. It's our tribe, and sometimes it would feel like, I remember growing up as a teenager, like why we're only spending time with our own people and feeling like we can't trust other people. But I realized because there's been a lot of oppression, like by Muslims or the Hindu government, that we can't trust people who are different than us because it's a threat to our safety. But so learning to even rescript that for ourselves. Today we're in America, we're in there's so many different beautiful ethnicities and so many different people to learn from. And can we still have difficult dialogue and learn to conversate, even that there's fear, because the only real way to get over fear is to immerse yourself in another culture or with the other person. Because fear is really just about the unknown, right? If you think about why we're afraid in general, fear is just generally, it's the same thing as anxiety. It's when you don't know. That's why we're afraid of the dark, because we don't know, we can't see anything, we don't know what's happening. We're afraid of death because we don't know what's happening, what's going to happen after. So the more we learn to understand about ourselves and then also about others, and are able to sit in the room, even if we disagree, and are able to have conversations, it does bring us closer together. It helps us to feel like we can feel safe and connect and be in that state, which we'll talk about later. In polyvagal theory, we talk about this ventral vagal state when we're feeling safe and so able to be curious and socially connect. But if we're stressed, if we're living in fear and anxiety, the brain, the nervous system cannot do that.
Okay, well, I had another quick question about yoga, and because you touched on, yoga and being a part of your training and being integrating that into your approach with clients, and I would love to hear more about how that has what that's looked like for you as a practitioner, as well as how the outcomes of your clients and maybe you can also share some hope because some hope around where you see mental health going, the field going today with these new modalities being kind of interwoven into CBT and these other sort of Western practices.
Yeah, I think it's such an exciting time to be living as a clinician where we can teach yoga and mindfulness and meditation even in hospital settings. And these practices have been around for over 5,000 years, so it's not new, right? But it's new to the Western world, and now it's being accepted because now there's all these studies and all this research being done on when we're doing the asanas, the movement, and even the breathing practices and meditation, what it's literally doing to our brain structure and the function of the nervous system, that it makes sense why we feel more grounded, why we feel more safe. And there's been a lot of research being done on how it helps to manage stress and anxiety and depression. And so yoga actually became an anchor for me personally when I was going through a lot of stress and after a traumatic experience in my own life that I had gone through. I started going to a yoga studio, and there it just, I felt safe. I felt connected, but it was quiet. So I first started practicing yoga in 1999 was my first class, but I didn't start practicing it regularly until about 10 years later in 2010. And that's when I would go to a studio. I would go to San Francisco, and I found this kind of old school, it was like this hippie studio. Like they don't really make them like that anymore as much, but they were master teachers there, and it was very disciplined. but it felt very safe, like it was because it was so structured and it was quiet. It was a meditative experience, but you are an individual within community. So even in the practice that I was learning, you're paying attention to your own poses and, just kind of checking in with yourself. There was no hierarchy on, like a low or high level class. It was just like come as you are, and just practice with what you have, and without judgment. And as I was learning it, and started practicing more on my own, and then I was in grad school learning more about psychological distress and anxiety, depression. It just seemed like it went hand in hand when it came to the treatment of those things. When it, like, people need to connect, they need to let go of the self-critical beliefs and the thoughts that they're having. They need to let go of the judgment, and they need to learn how to regulate their own emotions. And I felt that myself from yoga. So that's when I did my teacher training back in 2014 the first time. And then I've currently done some more advanced trainings since then. And now again, we have even more science to back up what these ancient practices have been teaching. And to me, that's super exciting because this is something that, being an Indian woman and being from India, it's something that resonates. And it's also something that I now feel comfortable sharing with the larger collective in this community, because I feel like people are willing to accept it more because there's some science, behind what the biological mechanisms that are occurring in the brain and the body when we're doing these things. It's not just I feel good, or it's not this new agey thing anymore. It's more like, no, these practices are designed in a specific way, and there's so much benefit that we can learn from these practices.
Yeah, I was wondering because a lot of people kind of hear yoga and they kind of think it's a lot of these poses, right? And so when you kind of say you're a yoga psychologist instructor, that's very exciting to me because, not many people talk about the psychology of yoga. It's usually where does your body move, maybe some breath, but like we really don't talk about the psychology of it. So I'd love to know more about how is it different from, what a regular practice that the West actually understands.
Yeah. Thank you for that question. Because a lot of times people do, when we say yoga, they are thinking about the asana, which is the physical movement, and that is part of it. But yoga is also, it's an entire philosophy from the Vedas. There's a whole lifestyle practice, and it really includes what they call 8 limbs of a tree. So one of the limbs is asana, the physical movement that we need. But there are other limbs that include meditation. And so being able to sit with yourself and quietly and reflect on what it is that you're experiencing internally. And there's other things that we need to do in order to help support that too, like our diet and nutrition. There are thinking and our belief patterns. There's this entire philosophy around our beliefs, our thinking patterns, and our emotions, and how we're managing that through movement, but also through meditation. There's breath work. There's again, diet and nutrition. Ayurveda is also linked to yoga, which is the science of life, is what it literally means. But it's an Indian medicine where the recommendations, well, they'll give you specific poses to do to treat your ailment. They'll give you specific nutrient guidelines, herbs. There's like chromotherapy, which is like the colors that you should be wearing and engaging with. There's gem therapy. There's so much to it. It's very complex. And so when we say yoga, I feel like we do get sometimes like a watered down version in the studios that we have access to today. But I do have appreciation that there is something is better than nothing. But that's only like one little piece of what true yoga is.
I love that you shared the complexity of the yogic philosophy, which also includes, like you were saying, Ayurveda and all of these things. How, and you are an Ayurvedic practitioner as well, and I'm curious to also hear from you about how are your patients or clients receiving this approach from you?
Some clients are more receptive to it than others, so it's not something that I honestly discuss with every patient that I see, because they do mostly come to me from for CBT therapy. And so, but depending on the client, if I feel like that they're open and receptive to learning more about yoga philosophy, and doing breath work, that it's a good introduction for them to learn more. And I introduce them to specific concepts. I even do meditation with them in session. I've done it in groups and also one-on-one in individual therapies. And if they find it beneficial, if I find that they're more curious about it, then we'll go a little bit deeper and share more about, you can learn about Ayurveda, and there's a full assessment that I can do with the patient just to kind of find out what where they fit in, and what kinds of needs that they have, and depending on, and that changes all the time too. It should changes depending on the season, the time of day, and the body type that we have, and how we're constantly, kind of managing those things. So it can go very deep in that direction with some clients, but some clients like to keep it more about the thinking brain, and how we can just manage our thoughts and our emotions, and they like more like the hard science, when it comes to
Sure.
things
Yeah.
that they're more comfortable with. So I kind of take it patient by patient.
That's pretty amazing that you're able to, like, patients go to you and they just, think they're getting one thing, right? Which is most of the time what you get when you go to like a regular, just, regularly trained CBT, practitioner. And then it's like, whoa, actually, there's so much depth to what you have to offer clients, which is so beautiful. And I'm just imagining, when we talk about like reimagining or envisioning what a better healthcare system can look like, and this idea of healers that embody this wisdom and actually take care of themselves. Like, I think of you and I think of what you're doing, and it's just really beautiful. And I'm so I'm really grateful that healthcare professionals like you, mental health care professionals especially, that come with this really holistic approach, truly holistic. Like you were talking about, the food and the doshas and all of these things. So thank you for bringing that and really really embodying it.
Yeah, I mean, the human body is so complex, right? There's so
Right.
much to us. We're not just biological, physical beings. We are spiritual. There's all these different mechanisms that are working together all the time. And so the more we can learn about our bodies in different ways, and better we're able to help ourselves and to support ourselves when we're going through distress or uncertainty or whatever it is that we're experiencing at any given moment. So the more, it just gives us more. I feel like it's a menu of options that I provide my clients, and they become anchors in healing. Like, what is something you can
Mm.
for yourself that feels good today? Maybe it's not going to feel good tomorrow. So, having different options for yourself, and that can again be individual, and that can be as a collective, and then they can be, during high stress times, during low stress times. What are some different things that we can do to manage that? There's, because the body's so complex.
Absolutely, absolutely.
Yeah, it's really exciting to kind of see how you're bringing a lot of this yoga practice together. And it kind of goes to our next topic where, it's really exciting that, the both of you guys are actually talking about trauma and yoga at the Sedona Yoga Fest coming up, which is our background today. So this kind of like a nod to kind of give everybody a teaser of, what you guys are really compiling together and really developing this yoga practice a lot further. So I'd love for you guys to kind of share a little bit of, tease us a little bit of what you guys will be kind of talking about at this yoga fest.
Yeah. I don't know, Diana, do you want to start? Do you want
Go ahead, Minnie. No, I would love to hear you. Yeah, please. And then
Yeah.
I'll chime in.
Yeah, so we're going to be really talking about I mean, one of the things that we'll be talking about is polyvagal theory, which is it was developed by a neuroscientist named Stephen Porges. And it's really describes the way our autonomic nervous system works and responds to our daily experiences. So our automatic nervous system is really like the heart of our daily experience. It's made up of the parasympathetic and sympathetic systems, which work in a hierarchy and predictable order. And by understanding that predictable order that our biology, our bodies work through, we can understand how trauma has impacted us, and stress, how that impacts us, and even understanding the pathway back to regulation and healing. So polyvagal theory can be thought of through three. We're going to go over those three basic organizing principles. So one is that hierarchy, the hierarchy of three states. So there's like the ventral vagal system, which is the regular when we're feeling safe. The body is feeling like, okay, I can feel organized, I feel connected. The organism is safe to be curious and explore its terrain and environment. So that's when we're kind of in a low stress state, we're mindful, and it's easy to connect, and because we feel safe. And but when we have stress or trauma, and thinking about even people who are constantly under stress and trauma, that elicits a response in our biological system. And so that's when we go into what we call the sympathetic nervous system. And that's what we know as fight or flight. And that's a survival state, so it'll go into this response to danger when we're feeling anxiety. So such as like feeling like we need to escape, feeling worry, feeling fear, and even panic. If it goes to, the more arousal we have, the more distress we're going to feel. And so it can start with like kind of worried and concerned, and then it can go up to fear, all the way up to panic. And so that's the anxious or the flight side of it. The other side is fight. So we can go into aggression. So like starting off with like frustration, irritation, anger, rage. And then that even itself, can go all the way up to this panic and rage state. But even when we're in sympathetic arousal, where the body's still mobile, it's still in this I can mode. It's still trying to figure out solutions. That's why it's anxious and it's worried. It's trying to toss and turn ideas in its head. But if that still doesn't resolve, then the body goes into this third state, which we call the dorsal vagal system. And that's when the body now goes into collapse. And that's where people experience things like helplessness, depression, feeling like they're not here. There's like a dissociation that occurs for some people. And, think about, you may even know people that have experienced a lot of trauma, feeling emotionally numb, feeling trapped, shame. And the body starts preparing for death and even trying to conserve energy. It becomes immobile because now it feels like the stressor has exceeded the demands of the stressor has exceeded our tolerance. So we all have like this window of tolerance when it comes to stress. So we have like self-care rituals to keep that window open. But if the demands start exceeding what we can, the capacity we have, that window gets smaller and smaller. And then all of a sudden we're trying to conserve our energy. We become immobile. And now it's like, I can't, so I might as well just play dead. And that's where we dissociate. We feel like it's just too much. So we'll go over those three states in a little bit more detail, but they do occur in that hierarchy. So normally we're in ventral vagal, which is like feeling calm and connected, which is where we should be. And then it'll go into fight or flight, and then it'll go into that dorsal state. And so we really also kind of come back down. They call it like a ladder, where we want to come back down the ladder, slowly. But it goes in that hierarchy. So we're going to go over some strategies to how to come back down that ladder if you're experiencing fight or flight or dorsal vagal freeze as well. So we're going to talk about, all of those things. What else, Diana?
Yeah, that totally, we're going to dive into that. I also, as you were sharing that, what was coming up for me right now was how many of the people, myself included, when I was, actively like a trauma nurse and doing all these things, were constantly in that sympathetic activation. And what does that do physiologically in the body. And it, so we'll discuss that, like the clouding, like the increased cortisol levels, and how does that cloud our judgment and our ability to make like decisions that are actually in our best interest. And so especially if we're in that state all the time. And so I remember those feelings constantly. Even as you're speaking to it, I can vividly, like I could feel it, wow, yes, I was in that state quite a bit. And you can see that kind of seep into our personal life. And what I'm really excited about also too is diving into weaving in the yogic philosophies that we're going to do. Specifically, this training at Sedona Yoga Festival is initially for yoga teachers, but we've decided to open it up to anyone who wants to join the training, because really this is applicable for all of us and relevant to all of our lives. So I think that we are all, whether you're directly working with trauma inflicted communities or individuals, or yourself are somebody who is a trauma survivor, this information is potent for all of us. And so we're really excited to bring a training that can be digested and is practical, and that anyone can really use and apply. And so some of the other components to the training will include looking at this idea of ancestral trauma and collective trauma, systemic trauma, and really looking at trauma through a lens of systems, rather than it being placed on an individual, and kind of coming back to that idea that we are individuals, but we make up systems. And most of the time, a lot of the times, the things that we go through or that we've inherited, like speaking what you were sharing, Minnie, about kind of epigenetics. We're going to talk about that, and how our DNA can be expressed differently, even if we weren't the ones who directly were experienced the trauma, but maybe our parents, and so forth. And so really also bringing this awareness around how to hold space for people who are, when you're like teaching a yoga class, how things may come up, especially when you're talking about things like breath, right? Or certain movements, and when we're moving things in the body, and when you start to understand like where we hold emotions in the body, things can come up out of nowhere, because most of this is sitting in our deep subconscious mind, right? So that's going to be really exciting to talk about and really share, like, how do we hold spaces that are that are culturally aware and trauma informed, and what questions do you ask when you are a practitioner that is embodying those two key components, right? So that's just a little bit. I mean, there's so much. It's a 20-hour training that we're creating, and we are just so excited to be doing this together, because it's so fun. It's something that we both are super passionate about, both have a lot to share, and really just want it to be fun, because a lot of these topics and trainings, as Minnie and I have been to many of them ourselves in these very sterile environments, it does leave out the spirit component. It does leave out that. And so that, as we spoke about before, it's a key part of who we are. We are spiritual beings. Whether your religion has nothing to do with it. To me, it's about the interconnectedness of everything. So that will be really fun, and I think it's a good way to start bringing that into spaces that may not be yoga aware, or people may not be practicing yoga, but we can still talk about these things in a way that are digestible for folks.
Right, right. And what you're really talking about is like this is less about thinking our way out of how to respond to trauma, but really it's not a cognitive exercise, but there's like this, what we call neuroception. So it's like, perception is when our thinking brain is really trying to assess cues from our environment, what's happening, and interpret, is this safe, is this danger? But neuroception is really our autonomic nervous system responding to those cues. So it's not about the thinking brain at all during that time. So you being a trauma nurse, thinking about when you were in fight or flight, it's really difficult to be curious when you're in that state, so you're picking up on your internal state, so it's like, is my heart racing? Am I shaking? What is my physiological response, which we get to tune into when we're practicing yoga. But there's also outside of the body, environmentally, is this place loud? Is it loud? Is it noisy? Does it feel unsafe? We're picking up environmental cues. And then it's also between people where we're checking out, what feels welcoming, or what are the warning cues from others. We're picking up on their tone of voice, their body language, their facial expressions, and even in ourselves, how are we expressing ourselves? Do we sound, for example, somebody that's monotone, that means they're feeling like there's danger, they feel unsafe, and there's like this rigidity that occurs. But when we're uh, more curious and more kind of like relaxed, there's even more facial expressions, and we're moving our head a little bit more side to side, we're not as rigid. So we're constantly picking up cues, not only from our internal state but also from our environment. And yoga is such a great way to practice that, because you're paying attention to all of those cues simultaneously, and you're also co-regulating with others to manage those arousal states. So you're kind of working in alignment and working in breath. And we do, as human beings, we do co-regulate with others all the time. And so we get to learn a lot of those things when we're practicing yoga together too.
Yeah, I love that you said that, because it really, yoga for me as well has been such a powerful practice to learn how to regulate my nervous system, but like you just said, to co-regulate, like if I am with somebody who's up here, I mean, even just the pace of walking, right? If you're walking with someone and they're going super fast or whatnot, to really just be like, I'm gonna slow down, I'm gonna take a deep breath, I'm going to go at my own pace. And you start to notice the shift in the other person as well, because they start to mirror what you're doing. And it really, really changes things. So that's really fun to play with too, as you start becoming aware of these things.
Yeah.
And you're like, wait, why am I walking so fast? Or why am I running? Or why am I talking so fast? Why is this all of a sudden I feel my heart rate, and yoga really does help us to bring, and the breath, and really these practices really help us to come into awareness of what's happening in our body. Then we can understand, and like you said, walk back down that ladder, right?
About slowing down, like you said too, right? So when we're doing like diaphragmatic breathing exercises, it helps everything we slow down. And sometimes we're not aware of how fast it is that we're talking or that we're going. And when we even just stretching out our words, and slowing down just by that can help to calm the nervous system down. Or just in the way we're moving, like you said, can I slow down in my walking, or even when I'm eating, slow down and do some mindful eating. That in itself helps the body to feel safe, and like, okay, I know what's happening, and I'm safe, I'm okay. And it's sending cues to your brain and your nervous system that we're not in a state of threat or danger here. Because we can slow down. And you're kind of even using your physical body to regulate yourself in that way. And we'll go over a lot of different other ventral vagal exercises. So diaphragmatic breathing would be one of them. Another one would be savoring. So even your the audience now that's listening, you can think about something that you're doing today, and can you slow down with what it is that you're doing, and even taking it in, savoring the moment. Even if you're eating something, really savoring flavors. Or if you're looking at something beautiful when you're out on your walk today, can you really savor that moment and really notice what it does to you? How do you feel when you're able to savor and to slow down? And it does literally reset our nervous system to feel more safe and more calm and relaxed.
Yeah, what's really great is you guys are really talking about, really, you start with like the people who are coming in with depression and actually, clinical indication of a problem. But when you guys were describing everything, it seemed like actually everybody could actually get a lot out of this, right? Because this idea, even just like addiction, right? That addiction is actually caused by anxiety, and that anxiety, then when you go through withdrawal of this addiction, you're going through like releasing trauma. And so I love to kind of let's talk more about like the type of people who are interested or would be interested in coming, and who actually would be getting a lot out of these experiences. Because I think most people don't realize they have trauma, right? Like some of us don't realize we have anxiety. Or I know some people who say, oh, I live with anxiety. And so we've actually gotten to a place where we carry that fear and anxiety as a badge of courage. If you don't have anxiety, you're not working hard enough or something. Because, you know, in our Western culture, we're very much like work hard, work hard. If you don't, you're not successful. And so it's this perpetuating cycle that we keep thinking that anxiety and stress is good for us rather than actually learning to be conscious of these little triggers that might be happening to us.
Yeah.
Yeah.
I mean, some stress is good for us. You're right, right? Like, so we have eustress and then we have distress. So eustress is like that, you know, stress is designed to motivate us to get things done. And it does keep the body mobile so that we're able to take care of ourselves and be responsible out in the world and feel excited about things. Like, think about when you're about to give a very important talk or teach on something that's you know, to a large audience. You're going to feel some stress, and that's what we call good stress. So cortisol and adrenaline, these aren't bad hormones, they're actually good for us. But when we're in a chronic state of stress where it feels like the stressor is overwhelming and we don't have the capacity to manage it, then it goes into the state of distress and even burnout. And so that's where we want to learn, you know, okay, what are some strategies that I can do to make sure that I'm keeping that window of tolerance open? And what are the practices that I'm doing, not just for myself, you know, but even for the people around me. So maybe you know, if somebody comes, like, that's why I feel like this talk could be great for just about anybody, because everybody is experiencing, you know, some type of anxiety or stress, or if they're not themselves, they know somebody that is. So how can I help, you know, my friend or my family member co-regulate? How can I help them work through some more loving kindness and some more self-compassion and letting go of the self-critical thought beliefs, but more kind of working from that self-compassionate lens, which will also go through. And, you know, there's simple strategies that we can all learn from and practice ourselves, or even teach to others if you notice that they're in distress.
Yeah, thanks for saying that, Minnie. And when you just spoke about burnout, what I was thinking was this opportunity for, again, you know, people who aren't yoga teachers per se, but who are directly experiencing the burnout, the compassion fatigue themselves because they are dealing with these very traumatic situations when they're showing up for their patients, like physicians, nurses, whoever else is showing up in this way. And I'm curious, what can you share? Can you share like maybe one tool for anyone who to kind of keep that window of tolerance open, like you spoke about, like something practical? Maybe it's a self-care ritual, maybe it's a practice, like just something that the audience can take away to try and practice.
Yeah, thank you for asking that. You know, I feel like that's going to look a little bit different for everybody. So I want to be, you know, I don't want to prescribe anything specific where I feel like it's going to work for everybody. So I think
Spoken by a true holistic practitioner. Thank you for saying that.
asking yourself, what is it in my day that I get to do that I know that helps me feel more at a state of relaxation where I'm feeling connected to myself? And so for some people that might look like meditation or you know, yoga class, or kind of just being out in nature. For others, maybe it means having community, having social support, talking to somebody. But the main thing is that you have these anchors every single day, that you're doing something to reconnect to your ventral vagal system as an anchor every single day. Because if you keep going and going, it'll eventually accumulate, and then the stress just gets to be too much, and then it can go into a state of hyperarousal where we're now kind of having all of these physiological responses to what it is that we're experiencing. But when you have anchors every single day, it can be morning rituals, it can be evening rituals, it can be both. They can be spread out throughout the day. So during your break, you know, taking a 5 minutes for deep breathing, you can go take a walk for 5 minutes. Like, you know, I think we ultimately are the expert on our own body. So, you know, I can share a lot of different options, but I think at the end of the day, you know, you choose, get what works for you, and hang on to that and do more of it if you can. and making sure that you're doing it every single day, just like you brush your teeth. You know, it's mental hygiene for your health and for your emotions.
Thank you for that. And one thing I want to share quickly too is that, and maybe this is part of your self-care ritual, but Dr. Minnie is a professional bodybuilder, amazing, amazing fitness athlete, has been in competitions, just came back and was at Arnold Schwarzenegger's show in Ohio. And is that something that works that supports you in your mental stability and strength? I
Absolutely.
can imagine.
It sounds so funny because, you know, exercise for me has always been that moving meditation where it's a time out for myself. And because you're really focused and you're engaged on the muscle or what it is that you're working, but it's also my opportunity to just focus on myself. And it is a meditation practice in of itself. But as I started working out and taking it more seriously, I started connecting with other people that were at the gym, and just really started enjoying, you know, how it made me feel. It's not just the physical aesthetics that I'm going and working out for, but it's really the mental and emotional benefits that I get from it. And now even the social connections, because I'm going to the same fitness centers, and now I've started competing too. So it's like an exciting thing for athletes to come together. And the way the division that I compete in is in bikini bodybuilding. So they have divisions with every age group. So it's really inspiring to see women even in their 60s and 70s
Wow.
eating and really, you know, putting themselves first. It's such an incredible, I feel like self-care and self-love is embedded in this sport. And it's really interesting because it doesn't have that persona for many people. It looks like it's superficial, or you know, and that's kind of what I love about it, because you don't really understand it until you do it. And people have like this sometimes a negative outlook when it comes to bodybuilding, and it can be very unhealthy for some people. I can understand that. But if you're doing it in the right way with the right intention and you have support, it's such another beautiful way to understand your body and what works, and to understand the mechanisms of how this system works. You know, you understand your digestion, your immunity, your bone structure, your anatomy. You're learning all of that when you're bodybuilding. So I love it for that.
Yeah, well, what I love that we've been talking today about is really this idea of right, you're going back to the cognitive therapy, that you want people to become self-aware of what's happening to them. And that's kind of the beginning of the change that they're going to have to go through, right? You know, for me, like as a physical doctor helping kind of in acupuncture, we deal with a lot of the physical, but a lot of times we don't have the time to talk to them through some of the mental problems that they're causing, because a lot of their habits are caused from their like lack of self-awareness, right? And so they kind of go into this like spinning downward into like depression or some physical problems. And a lot of times they kind of go, hey, can you help me physically? Yet they never really address their mental capacity to actually be the one to change themselves, right? And this is where I find a lot of holes in the Western space, where we're so focused on someone fixing you physically because you feel physically uncomfortable, but yet like people don't understand, like actually it starts from your mind, right? This, you know, where you're talking about the perception or the neuroception, which is a really virulent way, because it actually bypasses this thinking and actually talks about how your body itself has this self-awareness, that you're not having this communication with it. So I love, because then this whole idea of bodybuilding is actually you tuning your body so well that you are able to cognitively understand what your body is going through, which I think, you know, in today's kind of society where we kind of do very bad habits and we kind of like blame other people for it, you know, this is where I think, you know, it brings back the ownership to the person, right? Because, you know, in the end of the day, like when you were saying, the tip is you. You know, if you understand your problem, that's the tip, you know. Otherwise, everything else is just you're getting lip service, is kind of what I say in the West. There's a lot of lip service. And so people then start blaming, oh, doctors are not the one helping me. Actually, it's your job, right? So it's very, you know, actually very self-empowering what you guys are talking about, because it really brings back the ownership to the person themselves.
Yeah, exactly.
Yeah, and I think that's why we're here, with this show. And also I wanted to honor you again, Minnie, and really share excitingly that this year you have joined the board of directors for Cultivating Self. So, yay! We're so happy to have you. That is huge. It's huge to have somebody with your experience, wisdom, and what you are practicing and bringing into the world, and bringing your wisdom to the organization. So I wanted to really share that with everyone, that we are so grateful that you have joined. And I'm also just curious if you could share a little bit as to why you decided to join the board, and what you envision for this organization. That's
Yes.
sponsoring the show, by the way.
So I'm here to learn, I'm here to help and be of service. And, I want to join with people on the same mission and aligned values. And I feel like, again, coming collectively, like this is an opportunity for us to share ideas and be out in the community and do all kinds of work, to see, is it in the yoga community? Is it working with first responders? Is it working with nurses in different ways? That we can all be of service. If there's some value we can all bring, and when we come together, we can really embrace those signature strengths that we each have, and the diversity of our experiences coming in together. That there's so much knowledge that we can have just in the few of us that are coming together.
Yes, thank you. So for all of you guys who are watching, the Sedona Yoga Fest is April 26th through the 30th, right? In
That's
Sedona,
right.
so tickets are sale now. So if you're interested, please, log in and sign up for the beautiful trauma yoga certification they'll be offering. Because is this going to be the first time you guys are presenting it, right?
Okay, yeah, this is when we're presenting it. And so we will, you can follow us on Instagram for a discount promo code and get some discount off your ticket. But we are excited to be sharing this with you all. And thank you so much for joining us, Minnie, today. We're honored to have you.
Thank you.
Thank you
Yes.
for your service to the world.
Yeah, I look forward to seeing you in Sedona.
Yes, we'll see you soon.
Bye.
Bye bye.